Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Kashif. May I know what brings you here today? Okay. Anything more? I'm very sorry to hear about it, Mr. Kashif, and I appreciate that you are concerned about your health. But before I come to the management part, I'll ask you a few questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mr. Kashif. So Mr. Kashif, since how long you are suffering from fever? Can you tell me about the pattern of fever? Okay. Slow in morning and gradual increase in the night. Okay. And if it is associated with chills? Any nausea, vomiting? How about your appetite, Mr. Kashif? Okay. And how about your bowel habits? Do you have loose motions? Okay. Have you noticed color of your stool? If it is black in color? Okay. Mr. Kashif, how about your urine output? If it is adequate? Have you noticed color of urine? If it was red in color? Have you noticed weight loss? Okay. Is there any rash, Mr. Kashif? Okay. It's generalized or it's localized to particular areas? Okay. Do you feel any mass in your tummy? Okay, Mr. Kashif, is there any bleeding with the stool? Okay, and what about your tongue? Okay, Mr. Kashif, is there any similar complaint in the past? Is there any previous hospitalization, history of hospitalization? Okay, do you have headache, cough? Any recent travel history? Okay, Mr. Kashif, I'll ask you a few personal questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mr. Kashif. Mr. Kashif, do you smoke? Do you drink alcohol? Okay, do you have any high blood pressure? High blood sugar? Okay, Mr. Kashif, what do you do for a living? Okay. Okay, and how about things at workplace? And how about things at home? How about your sleep pattern, Mr. Kashif? Okay, Mr. Kashif, is there any member of family having a similar condition? Your colleagues in the rural area also have similar complaint with high grade. Okay. Okay, Mr. Kashif, are you taking any medicine prescribed by a doctor or over the counter? Do you have any allergies? Mr. Kashif, how this condition has affected your life? I'm very sorry to hear about it, Mr. Kashif. I appreciate your concerns, and I'll try my very best, my abilities to solve your issues. Okay. Anything you are worried in particular? Okay. No, you need not to be worried, Mr. Kashif. With proper treatment, it is curable. Okay, you need not to be worried. Okay, and Mr. Kashif, in order to reach my diagnosis, I need to examine you. Is it okay with you? Thanks for your cooperation, Mr. Kashif. Can you please move on the couch and lie down? Okay, Mr. Kashif, would you please lift your shirt up to the chest? Thanks for your cooperation. And then I'll sanitize my hands and let them dry. And I'll start from the general physical examination. I'll look at the face of patient if his look is toxic and acutely ill looking, and if he's malnourished, pale or dehydrated. If there is any jaundice, anemia, I'll ask patient to look down, look up, show me your tongue. I'll check a tip of nose for sinuses and tongue for coated V-shaped tongue. And then on the skin, if there are any erosive spots on chest, perambulicus. And then I'll check shins for edema. And then I'll check the pulse if there is relative bradycardia. And I'll check the palms if there is any palmar edema. I'll check nails if there is any koilonchia, spoon-shaped or clubbing or pitting. And then I'll look at the abdomen. First I'll inspect if it is sunken or distended, and if there is a symmetrical movement and it's symmetrical, and I'll check the pattern of breathing, and then I'll look for if there is any scar, any deformity, any bulging, and then I'll examine. First I'll ask patient, do you have any tender area or pain in a particular area, so that I can examine in the end. Thanks for your cooperation, Mr. Kashif. I'll examine you, okay? And if you feel any pain, let me know. I will stop then, okay? And then I'll do a light inspection, and then light palpation, and then deep for arthromegaly, and if there is any tenderness, and then I'll check for shifting dullness, and then I'll check for meningism, and I'll flex the neck of patient. Thanks for your cooperation, Mr. Kashif. You can cover your abdomen and move to the chair. And again, I'll sanitize my hands. Okay, Mr. Kashif, in order to reach my diagnosis, how it sounds to you if we are in certain blood and stool test? Okay, we need blood culture and stool culture and one ultrasound abdomen. Okay, but before I order, let me ask you if you have gone through an investigation so far. Okay, okay, Mr. Kashif, 50 years. Okay. Okay, so Mr. Kashif, from the information you have shared with me and the examination I have performed and already done investigation you have shown me indicate that most probably you are having a condition what we call in a medical terminology as typhoid fever. Okay, do you know anything about typhoid fever? Okay, so do you want me to explain it to you? Okay, Mr. Kashif, you need not to be worried. I'm here to explain to you. Actually, it is a type of fever in which there are symptoms of high-grade fever, loose motions, abdominal pain, headache, malaise, fatigue, okay? And patients usually take about 4 weeks to become normal, okay? And there is a return of appetite, fever subsides, tongue clears out, pulse becomes faster with proper treatment, okay? And you need not to be worried. This condition is quite treatable, Mr. Kashif, okay? And you have to follow some strategies, like lifestyle modifications. Use clean water, boiled water, okay? Use soft diet includes banana, yogurt, broth, and soup and rice, okay? And lifestyle changes include wash your hands after going to toilet, okay? Use lots of fluid and juices. And I am offering you paracetamol for fever, 500 mg. You have to take it 6 hourly, okay? And I'm offering you a tablet ciprofloxacin 500 mg. You have to take it twice a day for 10 days, okay? Is everything clear till now? Yes, Mr. Kashif. So I hope you'll be normal by the end of 4th week. Okay. If person is probably treated, there is less than 1% chance that person might die of shock due to bleeding in the intestine or due to infection in the brain. Okay. Let me encourage you and I'll strongly recommend you to that avoid contact sports like rugby and football these days. Okay. Refrain from these sports which can rupture your enlarged organ, okay, spleen in the tummy for a few months. Okay. If your condition does not improve, kindly seek immediate medical help. Okay. And then we may need to admit you for further investigation or be antibiotic. Okay. Is everything clear till now? And a typhoid vaccine is available, one single injection as well. Okay. Is everything clear till now? Is there anything else you'd like to discuss with me today? Okay, Mr. Kashif, here is the leaflet. Includes all the information regarding your condition. I hope it will be helpful for you. Take good care of yourself. I wish you a speedy recovery. Bye-bye.